Welcome to today's show and tell. I'm Genta, I work at Lottie, and today you'll hear from Redbridge colleagues who will tell us more about their discovery into their adult social care front door. I will hand over to them in just a second, but again, just a few housekeeping rules. We will start off with a presentation first. There will be an opportunity for you to ask questions and have a discussion with presenters at the end of this session. The usual reminder, please stay on mute if you are not speaking, and we welcome your questions during the presentation. Please put those in the chat and we will take them at the end. That's all from me. I will now hand over to my colleague Corinne, I believe, and I will stop sharing.
Hi, thanks for joining us today. I know some of you might have been on our journey with our previous show and tell. So this is a little bit of a summary of our work so far and telling you about also our next steps. So we're going to sort of take you through that journey and try to sort of give you a little bit of a snapshot of the discovery period that we had between September and December last year. So a little bit about the project. We were facing a huge amount of demand at Redbridge. We have probably about over 1,000 port calls a month to the first contact team. 80% of those contacts, that's email, forms and telephone, actually end up just signposting. They're not actually coming into the service or to need extra help. So it's about how do we start to sort of build a robust service for the future, look at that demand and how we can sort of triage people in a much more sort of easy way and get to people before they reach crisis. At Redbridge, we use the 3 conversation model, where conversation 1 is very much around sort of based on questions from the Care Act. And we sort of try to ascertain people's needs and whether they can obviously go back out into the community because they don't necessarily meet the criteria. But also, are those people that are starting to face crisis and that we need that support? So taking them to conversation 2, and then obviously conversation 3 is around sort of long-term care and support in the community. So what we found is that, there's lots of information, lots of demand to the first contact team, and, we still with a lot of time with that whole triage and a backlog, and that backlog never really seems to sort of diminish. So you can go to the next slide, thank you. So what we wanted to do was to understand how and where residents learn about adult social care. We have so many different parts of the community, our advocates, our stakeholders that can support with that work, but it's a bit of a minefield, especially if you don't know where to begin. So it's identifying what information people need. Is that around about the metering for their cap on costs and so on, but also just about where to start. Maybe problems around parents starting to suffer with dementia. Where do they look for? Where do they go to help? And so also we wanted to try and find out about all the opportunities that were available within our community, as well as what we can support as a council to try and put people in the right place with the right information so that they don't end up in crisis. And one of the things we've found through COVID and our data, and our data's been telling us consistently, is people want to live independently. They don't want to go into care. They don't often want to ask for help, but it's about how do we use those networks and those communities to try and support this whole process to the front door of adult social care. So if we go to the next slide. And I'm going to pass to Jo now as one of our apprentices. Just want to highlight Apprenticeship Week this week, and we've had 2 apprentices on this project who've done brilliant work. So I'm going to pass to Jo, who did a load of research for us.
Cool. Thanks, Corinne. Morning, everyone. So my name's Jo, and I'm a User Experience Support Officer and Digital Apprentice for Redbridge Council, and I work to support this project. So as this diagram shows, we engaged with a vast range of service users for this discovery. In total, we've estimated that over 100 people were involved. The groups we spoke to include the first contact team, Redbridge residents, GPs and community organisations. And we did this through activities such as pop-ups, research sessions, interviews and co-design sessions. Adult social care services support a wide range of different needs, some of which aren't related to adult social care. And Redbridge has a diverse population of people, which is something I'll talk about a bit more in a moment. And this also adds to the diversity of needs. Because of this, we felt talking to this number and diversity of people was the only way of gaining a comprehensive understanding of what's behind people's motivations when they access support or choose not to, and what our opportunities are in terms of improving pathways to support. Next slide, please. So for the next section, we'll discuss what we learned from our research. As I mentioned before, Redbridge has an incredibly diverse population. Our Bangladeshi community has nearly doubled in the last 10 years, and 14% of our residents don't speak English as a main language. We also have a higher than average amount of residents with special educational needs and are expecting the 8th largest population increase of all London boroughs, with particularly high rates in the 33 to 44 and 65 to 74 age groups. This all has significant effects on our ability to provide support for adults. For example, we found that our advice can be confusing for some communities because they have different attitudes towards health or encounter issues with translating. And we were told that information wasn't always accessible for people with disabilities. And the fact that around 60% of our population come from BAME communities, yet around 50% of those using the service are from the white population, is certainly something we're going to need to do something about.
So as we learned more and more about people's experiences, we were able to map out this kind of ecosystem that describes the different places that people regularly interact with in their day-to-day lives. And that includes places that we as a council control, where services are influenced by policy and funding, but it also includes healthcare, education, and places in the community, such as libraries and faith groups. And it also includes safety and security for the public, such as the police. So there's lots and lots of different places that people might be touching into. And you can see that from the ecosystem that we have on the slide. There's lots of bubbles and lots of different places that people could be coming into. So we think that there might be a greater opportunity to influence behaviour and outcomes in places that aren't actually owned by councils. And our research shows that there are lots of volunteers and community groups that exist that already support that goal of people wanting to live longer. So as we continued through our research, we also started to see a sort of journey that people might take through adult social care. And this journey had a number of steps. People don't necessarily have to go through this journey in a linear order, but in fact, they might be looping or kind of bouncing between these stages. And you can see a diagram of this on the slide. Our research showed that this journey started off with people perhaps living without a care need, or perhaps they do have a care need, but they don't necessarily recognize it. However, something might happen in this person's journey that makes them realize that actually they do need that little bit of help. For example, if they've had a fall. When this happens, people might go out and have a look at some information and advice to help themselves or help someone they know. And they can get this from a range of places, such as from other people online or other places in the community. They might find that when they are looking for advice, they're actually having to explain what they need to somebody else. And again, that could be to a GP, a pharmacy, or even online through a digital form or tool. We also know that there could be barriers to doing this, and that could be because people are speaking different languages, coming from different cultures, or having a disability that makes this a little bit harder to do it in the way that services are designed currently. That person might also find that they end up being signposted to another service that is better placed to help them. Again, there are issues with this. They may get placed on a waiting list for a long time, or they may be passed or referred to different services who really aren't sure what to do with them. They might get help eventually, and then after that, But after that help, they might evaluate their experience and the impact of care that has been given to them. And we know that when people have had a bad experience with one service, they can actually lose trust in another service, and this can prevent them from going and seeking help when they need it again. So as we were also researching and looking at these stages, we started to notice that there were common themes that kept on popping up. In particular, the barriers that were stopping people from getting access to the help they need. We know that there are certain reasons that people were worried about reaching out to adult social care, such as fears of losing their independence or worrying about the cost of care. And this could be because they're concerned about losing their home to having to pay for the care. We also know that when people are looking for information and advice, they were having some difficulties with that as well. Information might be inconsistent or might not exist at all, or be inconsistent for different disabilities or cultures. We found that people valued human connection. Residents had told us that the first person they would reach out to is another human being. GPs told us that their older patients treated appointments as social visits, and this also echoed what our first contact team told us, that a lot of people called just wanting to talk. Finally, there is a lack of awareness around adult social care, and this isn't just with our residents, but also when we spoke to the community groups who weren't quite sure what to signpost people to for adult social care. This also came up with the first contact team when we spoke to them, who said that they get referrals from professionals who refer to them for things they don't even do. So I would like to talk a little bit about what we are calling a support life cycle. And the diagram on the slide here illustrates this. Looking at the journeys I just took you through a minute ago, we think that these journeys could be broken down into three key parts. When someone is living well, when they don't necessarily have a need, when something happens in that person's life, a trigger moment that makes them realize that actually they might need that little bit of help. And finally, when someone needs are quite complex and they're in crisis mode and need that urgent support from us. Again, people might not move through these stages in a linear order. They might start off living well. They might realize that they actually are struggling to remain independent in their home. They look for information and advice on that. They install the equipment that in their house, and actually they go back to living well without coming back into crisis mode. By helping people in those early stages of living well and realizing that they need help, we can prevent people from coming into that crisis mode. And that means that we can reduce the demand for services like adult social care. And it also means that the first contact team can really focus on those that have complex needs and are in crisis. Joe, can I pass back to you?
Yep. So to learn how residents want to feel when they use council services, we ran different activities. We gave individuals user scenarios and asked them how they might support those needs. We asked for feedback on existing tech, and we got residents to poll where they look for advice and information. Through this, we were able to get a better understanding of how people want to feel when they use our services. Firstly, our residents expressed a deep desire to be understood. They discussed the importance of creating spaces where they can be heard and acknowledged. Residents highlighted the significance of feeling valued and cared for on a personal level, and talked about the negative impact when they felt that this hasn't been the case. Residents want to feel motivated and equipped to initiate positive change in their lives, taking away reliance on the people who ordinarily support them where possible. And finally, residents want to feel comfortable and included. So it's important that our services foster a sense of belonging and ease. Next slide, please. So at one of our research sessions with residents at Redbridge Central Library, we ran what we called an inspiration station, where we showed residents different existing products and services that we thought were interesting and elements of which could be applied at the council. For example, we discussed with them Doc Ready, which is a website that helps people prepare for discussing their health issues at doctor appointments. And we also showed them the way the NHS uses text message reminders for service users. We got some really interesting takeaways from this. We found that users don't want extra work, and we need to cut out unnecessary steps in user journeys where possible. Users often can't find useful services, so we need to make things as easy for them as possible by putting them in places they are already looking. And finally, we need to generate added value. Our platforms shouldn't only offer just getting from A to B, but we need to be thinking about additional features, such as like personal recommendations. I'm now going to pass back to Corinne to start talking about how we can use these findings to improve our services.
Thanks, Joe. So at the beginning of the project, we did some reflective thinking and what we were really trying to solve around adult social care. Redbridge, as with many other councils, has had a huge increase in the ageing and changing population, and we're seeing real increase in the demand for adult social care services. And that's partly because cases we are seeing are more complex and urgent and therefore take more time. It's also because they're seeing an increase in calls that aren't actually related to social care. We get many calls around people that are worried about their bin collections or their recycling bins blown away even. It's also about people who are calling with more serious issues such as mental health, who can't get help elsewhere and don't really know where to go. Signposting, though, in itself is a really important service, and that's very much needed. But the amount of signposting that Redbridge and other councils are having to do means there's always a backlog of cases which are building up and take time to go through. The impact of the backlog means that those in crisis mode actually don't get the help they need as fast as they need it. And they get, people that have less urgent cases then also ending up sort of deprioritised. And they have to wait longer. And then sometimes why they're waiting longer, that period means that they start to get into crisis mode. So their condition might have worsened, and it could have been avoided if we got that help or had that conversation with them much, much earlier. So during the week 8 of our discovery, we ran a workshop and we invited different services and stakeholders in the council, like benefits and welfare, but also included partners related to adult social care, such as social prescribers, people from the Carers Network. In total, we had about 25 people, so really good attendance and everyone was really engaged. On the day, we shared with the group the research we've learned so far, including the personas and some of the slides that you're going to see today. And we asked them to identify the sort of priorities that they think that any new digital service should address. And that includes thinking holistically about living well, as Tricia mentioned earlier, and about different places where people find information so they can feel informed and up to date about where to reach out for care. They also identified about better communication with service users. So many people wanted to know where they were on the list. They don't have visibility. They're not sure where they are in the process. And obviously that creates extra demand. So from these priorities, they started to come up with ideas for services that could really help residents access information when they needed it and to make sure that they weren't getting into sort of difficulties. So from our co-design workshop, we came up with 20 ideas across 3 themes. These themes were looking at 1, helping people self-serve and easily find information and advice. The second theme was using digital strategically when it's most beneficial to residents and where appropriate. And lastly, working with communities and partners to deliver information and support. From the themes we created 8 concepts, which are digital and non-digital, and that will hopefully improve outcomes for residents in Redbridge. So the team now will take you through the different ideas.
Morning, everyone. My name's Zara. I'm a digital support worker apprentice, and I helped provide assistance on this project. So the first concept we'll be talking about is the Help Hub, which looks at creating and access relevant advice and information. Residents can answer a set of inclusive and accessible questions, guiding and direct services. This came out from our research, which revealed a common challenge where residents often struggle to find information, resulting in increased calls to the contact centre. I can even see this in my current role where I respond to customers' inquiries on social media, and I've noticed this reoccurring challenge as I constantly come across many queries despite the information being available online. This highlights the ongoing difficulties people face in navigating information effectively. Therefore, this concept will help to decrease demands and pressures on services. The next concept is made for me. If we can change the slide. Thank you. This concept creates a space where residents can explore authentic stories from individuals who've navigated various challenges like long-term illness or caregiving. This will allow residents to identify with shared experiences and discover new ways to seek advice and benefits. These stories will be made with the help of partners across the borough and provides an opportunity for residents to engage in using mixed media such as videos and illustrations. Additionally, by creating a concept that fosters trust from real-life sources, individuals can recognize and prioritize their needs with confidence and helps residents bridge this gap by offering a platform that is not only informative, but also empathetic and trustworthy. I'll now hand over to Christian, who will go through the next two concepts.
Thank you, Zara. Hi, my name's Christian. I'm a project support officer with the council that helped with this great project. So our third concept is follow-up notes. So this is when speaking to a service, a user can receive a notification that gives them a summary of things like who they spoke to, what was discussed, next steps, and any resources that might have been recommended during the meeting, such as other websites that have advice and tools for them. This can be a text, an email, or even a handwritten note, which I know we all misplace things, so might not be the best way, but be mindful of people that aren't digitally inclined. So we found that residents find it really hard to remember everything that a service says during and after a meeting, especially because some of them are in crisis mode when these conversations are taking place. So this notification service will help the resident be able to revert back to everything that was discussed at any point in the future. For concept 4, it's called Train Me to Triage. So we know that residents often visit key places in the community, such as libraries and pharmacies. This means the people working at these locations are really well placed to help those in the community that may be struggling. This training will help those employees to identify people that are in need and get them support by, for example, showing them online tools and most importantly, having a method of referral. So the council's first contact team will know that these people have already been triaged. So we found not only there are people in the community that prefer that in-person contact as their first point of contact, but there's also a lot of people that don't even know where to start to find help, but we do know that they visit these places. So this training will help those employees at these key places support these types of residents. So for concept 5, I'll pass over to Trisha.
Thanks, Christian. So concept 5 for us is a do I need to pay tool. So this concept is based on a prototype that's been set up by North Lincolnshire's councils discovery into adult social care. It uses 3 questions about the support someone needs and a high-level view of their finances. So the tool gives a quick indication about whether someone will need to contribute towards their care, and this would work hand in hand with a more detailed tool that we already have on our adults website. It would make it easier for someone to get a quick answer about what to expect without needing them to enter lots of personal information, which we know can be quite daunting and off-putting. It can also explain the cap on care policy in a way that people can understand and apply it to their own situations. The tool itself will use plain English and provide clear explanations, as well as be available in different languages. This will help people to kind of plan ahead for their care and make any financial contributions less of a shock when they need it. So the 6th concept is called My Redbridge, and this is the idea of having a digital profile with the council. The council itself provides extra value to residents by providing records of recent transactions, reminders of bills, collections, and council tax. But we feel that we can offer more, a tailored content and signposting to residents as and when they reach different life stages or as they interact with other types of council services. So this can be a place to check in for activities relating to someone's care. It should be developed and as part of an ongoing relationship. It will be easier for people to self-serve. People will feel more informed and in control when they're using council services by having a place to go to for online updates. It can also provide a link to other resources and information to increase the chances of people finding the help and information they need without having to call us. And the council can adapt and improve services and information based on the data and insights of how and when people access this. I'll pass you on to Corinne to talk through the 7th concept.
So thanks, Tricia. Our 7th concept is a auto referral service, and it's a connected system for social prescribers. That helps them directly refer to services without the need to go through the first contact team. By answering some questions about a patient, they can be shown a list of available services, and the tool allows them to create and send a referral for the patient, and they can log in and track and progress this on the patient's behalf. And the service can also link up to the follow-up notes that Christian mentioned earlier, so that people can keep informed and up to date around progress via email or text. It can also be linked to the My Redbridge account, which hopefully would reduce the amount of calls to the first contact team, which ultimately reduces signposting and the questions that reoccur from time to time. Our last concept is I Need Help tool. So this is taking conversation 1, as we spoke about earlier, the 3 conversation model, and making this a digital journey. It triages through a series of questions, whether to signpost back into the community or to information, or accessing those support networks that we've been talking about earlier through our sort of stakeholder group, or to direct to someone, to an officer, because they are obviously reaching that crisis point, or we can see that they need help urgently. So we're starting to sort of help with that backlog through this sort of tool, but it also starts to humanise the process. That's one thing that all our research sort of told us, is that people want to feel like they're having a proper conversation. And so this tool starts to enable that. We know, as we said earlier, that the amount of calls that we're getting to the first contact team, this would help with that initial triage, the call drop-offs that we get, the length of time it takes to get through a conversation 1 is roughly about 45 minutes on a call. So you can see that trying to get through that backlog is really difficult. So this digital first approach means that people can get the information they need when they're searching for care or support very, very quickly, and signpost them to the right sort of support at that point of contact. And those that need those more complex cases can go through to conversation 2, where they actually do speak to an officer we can start those assessments, etc. This prototype is due to start in the next few months, and we hope also that you'll be able to join us on that journey and see the development of this particular tool, and that will sit along our website. So if we can go to the next slide, Trusha. So we built last year a new adult social care site. We've had great results and analytics from this. It has a great directory and signposting, and we work with our community to make sure that that content is up to date and helps people to sort of self-serve. So it was our starting blocks for this initial piece of work. We see that some of these concepts and tools will sit alongside this website, especially the I Need tool, and how we can develop that further so that it isn't such a mind sort of field of where to start, where to get care and support, or ask those important questions that people need to ask, even for their family members or for the people around them. So in summary, the 8 concepts all provide varying forms of support and contact through journeys in adult social care. And the research and meeting those involved in our adult social care journeys means we've got a clear roadmap of how to improve the customer front door and how we can enable people to self-serve and use conversation digitally and reduce the demand to the first contact team so they can deal with the more complex cases and provide those getting into crisis the care they need very quickly. We also know from our research that ecosystem is not exhaustive. We continue to grow it. We will be doing that through our further work and iterations, but also the amount of engagement and those hard to reach groups we need to work hard at to make sure that those communities that we mentioned earlier that are not accessing our services and care that might be offered to them, that disproportionality means that we can sort of start to change that model as we go forward. We hope that this has given you a snapshot of the 12-week discovery and that we will continue to join us for the developments of the 8 concepts. And if you'd like to find out any more or have a chat, then you don't hesitate to contact us. But a few things to point out. Our discovery was an ambitious one. Our corporate director of people and acting chief exec, Adrian Loads, gave us that challenge to think of digital interventions. We knew that we had opportunities to build better and robust services in adult social care and to meet the ageing and changing population we need to help in our borough. This discovery has been a success for a few things. We spoke to the right people and we listened to their stories, that's staff, users, stakeholders and GPs to build an accurate picture. But what we hadn't anticipated was the great vision that they had to change social care for the better, to allow people to have choice and to live more independently for the future. So thank you to all our partners and to the support from Lottie, providing us with a much wider engagement to tell our story, and to all our partners, especially Dorset Council and Kingston and Sutton, and to those councils that also reached out through this research, and that was North East Lincolnshire and Essex. The support and encouragement too from the local digital team and the funding opportunity to carry out this discovery and this vital piece of work that hopefully we can scale up and for other councils to use in the future. But there's one final thank you, which is to our partner DXW, who weren't able to be here today, but and to our brilliant staff at Redbridge, the first contact team and the digital team who've worked really hard to provide the best outcomes for this piece of work. Thank you.
Thank you very much, everyone. You've got a couple of questions in the chat already, if you'd like to take those.
Okay. So just going to get the first one. About the mosaic ones, yep, I think that's something we can certainly look into, and we're happy to share any of our personas too. We've already shared them with some of our other organisations and councils, just to sort of maybe, obviously everyone's demographic is different, but just to start to sort of build up how you could use a toolkit similar to this to get to your data and your research and your findings about what would be applicable to your sort of needs and residents. How many of your users are needing care and how many are those caring for advocacy might need care? Wondering, so we only look after, as probably most councils actually, a very small amount of people. I think it's about 2,900 on average. And I think it's about 250 are in nursing care, 550 that are roughly in residential, and then the rest of that is a split between sort of people with disabilities, people with mental health, and you can sort of see that actually it's a very small amount of people, but a huge budget that we all use to try and support adult social care, and it's most of it is around this whole assessments and triaging of people. So, you know, if we try to sort of think about how we can flip this process in the future to better serve people, and also, you know, we've got to start to think about the cap on care that's expected to be increased next year after the delay. And obviously there's going to be a huge amount of more people coming through the system. You know, we already know for Redbridge, there's about 26% increase by 2030 in over 65-year-olds. And obviously there's that demand that's constantly coming through the door. You know, we've got obviously issues left over from the pandemic, a lot of people that are presenting with working age, with mental health issues and problems. So that demand isn't going to reduce, but it's about how do we manage it? How do we get people that right help and sort of support? I don't think that anyone else has got any other questions.
There's two, sorry, you probably missed them because they're earlier on in the chat. So someone is asking, which software solution do you use to calculate if the service user has to contribute to the service?
So with the metering, you mean? Sorry, I can't see who's asked the question.
Possibly Sohal or Harky?
Yes. Hi, it was with meter, yes, for the pay contributions, the calculator.
Yeah, so I mean, we've been talking because of this project, it's obviously given us quite a lot of traction, and we've been speaking to some of the central government sort of departments too about some of their assessment tools and financial assessments, and I think that's something that we as councils will probably start to link in with some of the changes and the things that they are doing around the sort of statutory obligations that are coming down the line. But what we're trying to do is with our tools and concepts here, they will link to those assessment tools and those you know, how to pay, those quick sort of, rather than misleading people and thinking that they're going to get some sort of help and support. What we're trying to do is be really honest and transparent right at the beginning to sort of say, well, we can't help you as a council, but these are the things in the community that can and support you. So all these concepts will sort of link to either existing tools or ones that we can maybe develop that maybe make things and decision making much, much quicker.
Thank you.
Thank you, Corinne. There's another earlier question where Jane Hanser is asking, is the North Lincolnshire Council, do I need to pay tool free for councils to use?
I think that's still part in development and so on, but if you want us to give you the contact there, then we'll happily share that for you. I mean, I think this has been the great thing about this type of project is that, yes, you have your partners that you get as part of the funding, but in actual fact, people are doing great things up and down the country. We're all trying to solve the same problem, but it's just about how can we sort of, you know, utilise all of our ideas and innovation to try and make this a much more seamless process. So again, happy to share those contacts for you.
Sounds like sharing those contacts would be useful. And then you've got another question asking whether you've done any impact analysis on the finances, you know, looking at total number of people coming through the services to see the ROI.
Yeah, I mean, this is going to be the next stage of our work. Obviously, this is the discovery, which was really to sort of try and see the root cause of what we needed to do, the front door. And you can see, you know, it was ambitious. We actually only anticipated a sort of 8-9 week discovery. We continued that much longer. We would have loved to have done it for a longer period, but that's the next stage of our work, is to start going into a sort of a deeper dive and how we sort of start to bring those concepts and demonstrate the value for them in the future around efficiencies and how you can maybe sort of service redesign and again how we sort of look at the triage, train me to triage tool. You know, in Redbridge we're really fortunate we've got some engagement hubs, and they're in sort of, you know, real residential areas, and people might feel more inclined to go into those sort of spaces and speak to people. So we've got a lot of work to do in the next stage, but this has given us such a good roadmap of where to start and where we can maybe start to sort of look at you know, those ROIs, but also about how we can use our community better. Any other questions? That's great. Well, if anyone is, as I said, interested and wants to talk further, or we're happy to share anything. This is the whole point of this discovery. And, you know, we know that there's great work going up and down the country, and we've had lots of people in touch with us. And again, we're happy to sort of share. So please don't hesitate to contact us if you do. Brilliant. Thank you, Genta. Thanks for giving us this opportunity today as well to sort of tell where we are in our journey around the adult social care.
Just to say, last chance, I suppose, for anyone who has any questions, please do jump in. Please unmute yourself and feel free to ask your question. Yes, we will share the slides. Absolutely, we will. Just before we end, I just want to say we've got another show and tell coming up this very, very soon. So I will put a link in the chat right now. So yeah, please do sign up for that if you are interested in the work that's going on in adult social care. But for now, I just want to say thank you very much to all the presenters from Redbridge. Really, really good to hear about the progress you've made. And thank you very much for taking the time to share your findings with the Lottie audience. Just to say to everyone else, thank you very much for making the time to join us today. We will follow up with the slides and the recording as well. So have a very, very good day, everyone. Take care.
Thank you. Thanks.
Thank you, everyone.